Choosing a health insurance plan can feel, well, impossible. It's like trying to solve a puzzle in a language you don't really speak. But what if there was a clear, simple way to actually compare your options? Today, we're going to decode it together. Yeah, if you've ever just stared at a list of benefits and felt your eyes completely glaze over, trust me, you are not alone. These terms are the absolute building blocks of your healthcare costs, and getting a handle on them is everything. So, we're not just going to throw a bunch of definitions at you. We are putting two real-world plans under the microscope to see how all these confusing terms actually play out in your wallet. The goal here is to give you a method, a framework for making a smarter choice. All right, so for our case study, we've got two gold tier plans from Minnesota. One's from Blue Cross Blue Shield, and the other is from HealthPartners. Let's see what they're all about. Okay, right off the bat, you can see some pretty big differences. The Blue Plus plan has a way lower deductible. That's the cash you have to pay for services before your insurance even starts to help out. HealthPartners, on the other hand, has a higher deductible and a higher out-of-pocket max. But trust me, these numbers are just the tip of the iceberg. Now, what's really interesting here is how this visual shows you the trade-off. A lower deductible, like the one with Blue Plus, means your insurance kicks in and starts helping you sooner. But that out-of-pocket max, that red bar, that's the absolute most you will ever pay in a year. It is your ultimate financial safety net. And in a worst-case scenario, a lower number there is always better. So we've seen the big headline numbers. Now let's get into the nitty-gritty. How do these plans actually handle the stuff you're most likely to use, like a normal trip to the doctor? And this right here is a massive difference. With HealthPartners, you pay a flat $20 fee, that's a copay, right from day one. Simple. With Blue Plus, you're paying 25% of the total bill. That's called coinsurance. And here's the kicker, that's only after you've already paid your $1,200 deductible out of your own pocket. And look at this, it's the exact same pattern for specialist visits. HealthPartners gives you that predictable flat $20 copay. Blue Plus sticks with that 25% coinsurance after the deductible. So if you're someone who sees specialists often, that predictability from HealthPartners starts to look really, really good. And this is so crucial. This also applies to outpatient mental health care. So again, you're choosing between a predictable $20 fee with HealthPartners versus paying a percentage of the total cost with Blue Plus, but only after you hit that deductible. Okay, what about prescriptions? For the most common, low-cost generic drugs, the HealthPartners plan is the clear winner with a tiny $5 copay. The Blue Plus plan is $20. The good news for both, though, is that your deductible doesn't apply here, which is nice. You know, this quote from the source analysis just nails it. It perfectly sums up what we're seeing. HealthPartners is all about predictable, low-cost visits. The Blue Plus plan, its strengths are somewhere else, especially, as we're about to see, when costs get really high. So which plan is actually cheaper? Well, the answer depends entirely on one single thing: how much healthcare you actually end up using in a year. Let's look at the numbers. And this chart tells the entire story. In a pretty healthy year, or even a moderate use year, the HealthPartners plan is the clear winner. It's going to cost you less out of your own pocket. But just look what happens in a high-use year, say a year with a surgery or a major illness. All of a sudden, the Blue Plus plan becomes the much cheaper option. So why is that? So the bottom line is this. In that high-use scenario, choosing the Blue Plus plan could save you up to $1,500. That is not small change, and it all comes down to that one key term we mentioned right at the beginning. It's that out-of-pocket maximum. The Blue Plus plan's max is $7,500, while the HealthPartners one is $9,000. Once you spend that much, the insurance company pays 100% of your covered costs. That lower max is the financial safety net that just saved you $1,500 in our scenario. These donut charts give us a really simple visual summary of how the cost sharing works. The red section is what you pay, the green is what the insurance company pays. It's just a quick way to see the whole financial philosophy of each plan at a glance. So after all of that, which plan wins? Well, that's the trick question, isn't it? The best plan doesn't actually exist. There's only the plan that's best for your specific situation. It's a really delicate balancing act. You have to weigh the predictability of those low copays against the powerful protection of that lower out-of-pocket max. You're basically pitting what you expect to spend against what you can afford if the unexpected happens. Honestly, the best way to decide is to just ask yourself some direct questions. Be real about your health history and your comfort level with financial risk. Do you prefer paying a predictable, small fee for every single visit? Or would you rather have a much stronger safety net just in case of a major health event? So now you have the framework. The puzzle pieces are on the table. Think about your past year and what your year ahead might look like. Which of these cost structures, the steady predictability of copays, or the stronger safety net for the great unknown, which one gives you more peace of mind? The answer to that question, well, that's what's going to lead you to the right